has a COVID-19 vaccine been linked to anyone's death?
There is no evidence, to my knowledge, anywhere in the world of any of the vaccines that have been approved in the United States being linked to a death. This is closely monitored. The Centers for Disease Control and the Department of Health and Human Services run activities. One is called VAERS, the Vaccine Adverse Effect Response. And it documents anyone that might have any problem from anything in the time following a vaccination. And there has been no direct evidence of any death caused by the vaccine, to my knowledge.
Now, people have died after having gotten the vaccine. Explain the difference there.
So people die after almost anything. So there have been people that have died after getting a vaccine, and this monitoring system, this VAERS system, will evaluate this. And then if there is evidence to suggest that perhaps they should look into it further, they do. They're using that system, again, no direct evidence. These people might have been hit by a bus, and yet they are still included among people who died within a certain number of time. And to put this in perspective, I believe it's 0.002%, 1 in 50,000 roughly, of people who died in the weeks following vaccination. But again, this is from any cause. And those people, based on the statistics, would have died anyway. These were people who were going to die no matter what. They just happened to have gotten the vaccine.
So the vaccine itself, to the best of our knowledge and the CDC's tracking, has never actually been blamed for anyone's death.
That's correct.
But we did see the blood clots after Johnson & Johnson. Explain, that sounds serious to a lot of people. What do you make of that? And then put it in perspective if you can.
Yeah, so the blood clots, there have been a few dozen blood clots seen. I believe it's been in younger patients particularly. And it is very rare. Again, the likelihood of having this happen is almost zero, but it's very real in this case. And I think what it really boils down to is, what is your risk from being infected versus what is your risk from the vaccine? And it's a no-brainer. The risks from infection are magnitudes, thousands, millions of fold higher than any risk you would have from vaccination. And I think in the blood clots, they've seen that primarily in younger people. And so they're trying to avoid using the Johnson & Johnson vaccine for younger people, if it's possible.